And data available shows that thousands of children are born each year in Nigeria with a defect known as cleft lips and palate. Though the exact reasons for the condition is unclear, it can mostly be corrected through surgery. This report looks at the challenges, especially for most low-income families, in accessing timely medical intervention. Viewers' discretion is advised, as some of the pictures in this report may be disturbing.
Childbirth usually comes with overwhelming sense of joy and excitement for parents and the entire household, even though the task of nurturing the child is usually challenging. But for parents with a baby born with deformities, such as a cleft lip and palate, the challenge could be much more peculiar. This is a story of these two women, Victoria and Karimatu, whose experiences in nursing children born with cleft lip demonstrate courage, strength, resilience, and unconditional love.
I was not happy about it. I was just thinking of so many things in my heart. That how comes? How does it happen? Who did I offend? Is it from house? I was just thinking of so many things then.
Karimatu, who spoke in Hausa language, narrated how she was forced to hide her daughter for months because of the negative things people around would say about the child's condition.
I was told that this is witchcraft, that I should stop bringing out my baby. But later I met someone who told me not to worry. I should allow the child to grow, that it can be repaired.
A cleft lip or palate happens when the structures that form the upper lip or palate fail to join together during the developmental stages of a baby in the womb. This leaves the baby with an opening in the upper lip or roof of the mouth at birth, presenting not only physical but emotional challenges.
Cause is multifactorial, which means we can't pinpoint the exact cause. But there are some of them that we know that they are genetic, which means they are due to some problem, genetic problem within the family. Lack of folate or folic acid may also contribute. The deficiency we are talking about is the deficiency at the time the mother gets pregnant. Not by the time the mother is attending antenatal care, the problem has already taken place.
Figures released by Smile Train, the world's largest cleft charity organization, show that 1 in 700 children is born with cleft globally, while in Nigeria, over 6,000 children are born with cleft lip every year.
You know, in Nigeria, everything is why me, and we have this philosophy, it's not my portion. Everything we in our mind, in our subconscious level, our thinking is everything should just be perfect for us. So even if somebody sees a cleft patient near from a neighbor, the day she gives birth to her own, the first question is why me. Several parents, when they see this, because of the stigma that is associated with it, some people actually kill these children.
The awareness level of cleft lip and palate is abysmally low, especially in rural communities where the health-seeking behavior is usually poor. This, coupled with lack of income to cover surgery, misconceptions, stigma, and discrimination, are among factors that increase the burden of cleft lip and cleft palate in Nigeria.
At the moment, any child anywhere that has a cleft lip and palate, once they can get to a hospital that treats cleft lip and palate, it will be treated free. So presently, funding is no longer a problem. Even if the parents don't have money for transportation, the funding provided by Smile Train takes care of their transportation to get to where they need to get to for the treatment to be done. And there is no reason to hide the child. It may look bad because once there is a gap in the face, but it can be taken care of. And they don't need to go far for the treatment. Every state in this country has a hospital that can treat cleft lip and palate. And in many states, there are more than one hospital. Once it is repaired, the child will look normal.
The stories of these women underscores a parent's love, and the strength that comes from compassion and the burning desire to win in the face of adversity. Ogom Ezedimbo, AIT News, Abuja, Nigeria's capital.